Final hour of today's edition of the Chad Hasty Show. Thank you for tuning in today. Remember, you can follow me on Twitter at Chad Hasty Radio. Our next guest, we haven't talked a lot about coronavirus this morning, but that'll change a little bit with our next guest as we talk about not only coronavirus, COVID-19, but also we're going to talk about censorship, big tech censorship of medical doctors who, maybe have a different opinion about how to treat coronavirus and COVID-19 patients. And joining us on the phones right now, former Fox News contributor, member of the network's medical A-team, serves as the director of men's health at St. Francis Hospital in New York, Dr. David Samadi, joining us here on the Chad Hasty Show. Dr. Samadi, welcome to the show. How are you doing today?
Good morning. Thank you very much. Doing great.
Great. It's great to have you on, and I appreciate you joining us today. Before we get into the censorship issue, and before we get into hydroxychloroquine, I want to ask you just about what we're seeing with COVID-19 right now. How do you think the U.S. is handling the pandemic? How do you think the Trump administration has handled the pandemic? And do you see this virus, this pandemic, evolving?
So I think we're dealing with a huge country, 330 million people, very diverse, many different states with different kind of rates. And I think overall, the president has done really well. And the reason is because very few people have been able to bring in both private and public sector and really put them in the same room and say, I want the best lab that exists out there, and I want it now. And most of these developments of tests and experiments and clinical trials and research takes months and years. And he's been able to cut through the red tape and really provide this to Americans in a fastest pace I've ever seen that can happen in medicine. So for that, he gets a lot of credit. The travel ban, huge. The fact that he was able to recognize that we're not getting good enough information from China and they're playing games, all of that was really a great way of diagnosing and treating this issue that we have. I also posted something on Twitter yesterday. As you know, we have had a lot of problems with social media, but I said at this point the state of coronavirus is 90% politics, 10% medicine. Because if we all stay focused and do the right thing, we can get over this virus. And this is nothing that we've never seen before. We've dealt with a lot of different Ebolas and other viruses, and we can get through this. But we waste so much time attacking and blocking each other and making this into a big politics. And the waste of energy and time that goes into this and resources is what's delaying us. But I think overall, Americans, we've done quite well compared to many European and other countries. This is something that's under control, even though we see about 150,000 die. But those numbers, even though for the public, these are big numbers, but we're not dealing with millions. Those models predicted over 2 million people that will die in a short period, and we don't see that. So obviously, credit goes to the administration and the American public who responded well. Social distancing. The word social distancing is something that we don't understand. We never knew what this meant. Wearing a mask is bizarre for Americans, and this is not China or Asian countries, but they responded. They have done everything we've asked them to do, and they get credit for it. And there's going to be spikes in different states. Florida, Texas is going to go down. You may see Georgia. Georgia goes down. South Dakota will go up. This will continue for the next 6 months until enough of the country will build immunity, and hopefully we move on with this.
You brought up mask. How well, in here in Texas, our governor, Greg Abbott, he's told everybody to mask up. If you're going out into stores, you're going, no matter where, you need to wear a mask. How well do masks actually work?
I think there's more studies show and support wearing a mask right now than not wearing a mask. The problem is the mixed messages that's coming from Dr. Fauci, from CDC and other places is what's driving people crazy. And then there are some studies to show that the mask doesn't make much of a difference, and public are getting tired of it. The bottom line is I think today it's better to wear a mask. Part of the problem is that people don't know how to wear them. They keep touching their face. They bring it down. They're wearing around their neck. But, wearing a mask, even though to a lot of people may feel they're taking my freedom away. They're putting something on my face and I'm not free anymore. And I completely understand that. But I want them to know that this is not going to be the new norm. I understand how the mainstream media is turning the rhetoric from 2 weeks of flattening the curve now to like 6 months of this stuff. But I don't want them to think that this is going to be permanent. We're not going to be in masks forever. We're not going to be just doing social distancing forever. And it's also an election year, so everything is powered up by a lot of politics. But I think if it's going to slow down the process, we should wear the mask for the time being until we get through this hurdle, and we'll be fine. And that's my message to public.
Yeah. Visiting with Dr. David Samadi, do you think there will be a vaccine for this, and how accurate or how effective will that vaccine be if they do come up with one?
There will be some form of vaccine, and the key question that you're asking is how safe, how effective, and how long will it last? Is it going to be an every year type of vaccine, or is it going to have long-lasting effect? Is the virus going to mutate like influenza, so every year we need to get a different one? Is this virus going to stay with us, and it's going to be forever? We have to deal with this name? And all of those are very good questions that we don't have answers to them. I think we will have a vaccine soon. I think that a lot of people, there are some 30% of the country that are anti-vaccine, skeptical. They're not going to touch it just so they don't take the flu. There's going to be 50% of them that are going to take them. But I think nursing home, elderly, people who are, this virus is going after and that are the target, diabetes, obesity, high blood pressure, those people should take the vaccine, and the rest we need to look at and see how it's going to pan out, and it's a personal choice. I also think that mandating things in this country doesn't work well. Medicare for all, mandate vaccine for all. Things like this, everything that ends with for all at the end is a very socialist type of mentality, and it just doesn't work in America. I think we need to give people the option. They need to listen to risk and benefit, pros and cons, treat them maturely, just like we, as a doctor, we talk to the patients and let them make that decision for themselves and their families.
What are your views on hydroxychloroquine? We hear from some medical experts who say, hey, it's worked for some of our patients. We endorse the idea of taking it. The president has I think he has taken hydroxychloroquine. And then you have some doctors who say it's the worst thing in the world and you should never take it.
It's a sensitive drug right now because it's been so politicized to the point that when you talk to even some doctors in the hospital, they don't let you finish your sentence. The minute they hear the word hydroxychloroquine, it's like the end of life. I don't want to hear it. There's no study to back it up. Don't waste time. On the other hand, as you said, there are people who have taken this medication and it has saved their lives. And again, this goes back to the time that President Trump, sometime in February, March, we had no treatment. We didn't know what this virus was going to do. We had no idea the mode of transmission and how many people were going to be affected. And once he mentioned that, it became very politicized. There are some studies suggest that this may work, even though those studies were given along with steroids, and it could be the effect of steroids. It really doesn't matter. As long as we can save lives and we can stop, listen to this, as long as we can stop the patients from going to the hospital, the mission is accomplished. Whether that's going to be hydroxychloroquine or vitamin D, zinc, C, steroids, nebulizers, puffs, you name it, whatever it should be done and intervene early on to prevent people from going to the hospital, that's what I'm for and that's what I push. And so I think we need to look at every patient individually. Don't ignore your symptoms. When the doctor says, take some Tylenol and call me back in 3 days, that's a mistake. The sooner you diagnose it, the sooner you intervene, the sooner we can stop the inflammation that takes over your system and save your life. So I think there is room for it, but today we have a lot of other medications. Remdesivir, which is very expensive, but we don't want people to get to remdesivir because that's already when you're in a hospital. So I think there is room for it. You know, hopefully more studies will come to support it. I think it's cheap. It's been around for a long time. It's safe. and it may not work for everybody. You may waste your time with this medication, but early on, when you take it before the inflammation takes off, there seems to be some benefit.
So would you say, I mean, and again, everyone consult your own medical doctor here.
Correct.
If somebody, right now they feel fine, but they're worried about coronavirus, they want to prevent themselves from getting it, should they talk to their doctor about taking it even before they show any symptoms, or should they start?
I don't think so. I don't think there's any reason to take it for prophylaxis. I think that if you've been exposed and you feel like you're at a high risk, you're also in the high-risk category. If you're elderly, if you're obese, then I think that's a very good discussion, and the doctor may recommend taking it. But then the problem comes when the government comes between the doctor and the patient.
Right.
You give the prescription, they go to pharmacy, and the pharmacists are now like the king. I cannot fill it up because whatever. So this is a big problem that we have. But look, if you're a young 35-year-old, no medical issues, you think you've been exposed, you have no symptoms, I wouldn't go ahead and take the hydroxychloroquine randomly for prophylaxis. On the other hand, if you're older, you have medical reasons, and you've been exposed, and you're just starting to have symptoms, I would absolutely jump in and have a serious discussion with your doctor, and you should probably will take it, yes. So it's case by case.
One thing that, and you can follow Dr. Samadi on Twitter, as I do. One of the things that you've been tweeting about and talking about, and I think it's a big issue here in this country, is the censorship of doctors, the censorship of medical doctors, some who will say hydroxychloroquine, they'll actually say the word, and they get banned off of Twitter. They get banned off of Facebook and other websites. To me, we're censoring way too many medical debates out there. Is that your feeling?
Yes. We just put in something on Twitter on Dr. David Samadi, #Stop Censoring Medicine. And I want people to make this to become, even though I don't think Twitter will let that happen. But let the people go on my Twitter and look at it and retweet it. Look, in any medical discussion, you go into a medical conference, they put up a topic, whatever topic you want to be, hydroxychloroquine, COVID. Half of the room are going to go and they read the same article and they interpret it one way, the other half interpret the other way. That's healthy. That's a medical research. That's medical discussions. Nobody will say like, okay, you guys disagree with what I'm saying, get out of the conference room and lock up the door. You don't censor people because two doctors said these are the benefits of mask or not benefits of mask, and you shut down YouTube and you shut down Twitter. About a week ago or so, I woke up and my Twitter account was completely locked up. No warning, no email, no, we think that you're jeopardizing. And you have to understand, if you look at me for 12 years on Fox News, a few years on Newsmax TV, I don't go out there and say, we have the cure for coronavirus, here's hydroxychloroquine and take it. This is not the way I talk. I'm very, very careful about interpreting the data, what I put out there, etc. So to shut it down and censor me, it's crazy. It didn't make any sense. Yeah. We're back on again. But what I'm saying is the big tech are taking over your life. They're censoring whatever they don't think is right, and this should not happen in America. There's no room for it. And somehow the politicians need to jump in and take away some of the power from these guys, because otherwise we'll become another socialist country. This can affect our election. This can affect our life. This can affect everything. If you censor a doctor in America, then how are we different than any of these socialist countries? Yeah. Somebody will tell me. So we're going to fight it, and we're going to, to the power that I have. And actually our account has grown, and it's growing every day, and we're going to be fine, even though they keep deleting my followers and they keep doing whatever they do. It's just a game. Yeah. It's terrible.
Yeah, exactly. Dr. David Samadi, I appreciate you taking your time today and joining us. Hopefully we can have you on again in the future as we keep talking about coronavirus.
Thank you. I appreciate it. Thanks a lot.
Thank you. That's Dr. David Samadi from St. Francis Hospital in New York. Chad Hasty Show, KFYO.